Hi, my name is Mark and I've come here from Europe. I previously had gynecomastia surgery. I wasn't happy with it because there was heavy breast tissue sitting still on the sides of my chest and also up here in the corners and also in my armpits. It didn't look good and it felt uncomfortable. So I came here to Dr. Amit Gupta at Divine because he said that he can resolve this. He uses a technique called the 360 gynecomastia technique, and he said that he could revise my previous surgery and give a better result. It's now day 6 or 5 or 6 since my surgery, and I can see that the fullness in the areas that I didn't like is gone now. So basically the fat and breast tissue that I would have liked to have had removed in my original surgery is now gone. I'm very happy with the result. I generally trust Indian doctors. I had other good experiences with surgery in India. It was just this one that I wasn't happy with the result. So for me, it wasn't a question of coming to India. I knew I wouldn't go to Turkey. So it wasn't a question of coming to India. It was just a question of finding the right doctor to do the procedure the way I wanted it. You should not be looking to find the cheapest possible surgeon with your body. I mean, you know that if you come to India, it's going to be cheaper than probably the country that you're coming from. But you should not then try to find the cheapest possible surgeon within India. I think the factors that I go by would be reviews by previous patients, talking to the doctor themselves in the consultation, the qualifications. Reviews are obviously a very big factor. About the 360 technique, all I can say is that in my previous gynecomastia, I wanted there were areas that were not touched, which to me left a unaesthetic result. I don't really know why those areas weren't touched, but all I know is that when I spoke to Dr. Amit Gupta, he said that this is perfectly doable, that it is that what I had before was basically an incomplete gynecomastia surgery. And absolutely, everything that I wanted to be addressed previously has now been addressed. It's only 5 or 6 days. I still have swelling, but I can tell that the heavy breast tissue here and here and here that I was very unhappy with is gone.